get my stuff together.
We're all three here, so do the best part of the meeting, but be business.
Heavenly Father, we thank you, Lord, for always being with us. We ask, Father, your blessing on this meeting. We ask in Jesus' name.
Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Any citizens' comments? Okay, we'll move on. Retiree insurance. Our question is, do we want to subsidize? And if we do want to subsidize, what are our rules?
It's we're talking about the people under 65.
Right, from retirement to the age of 65. And right now we have, how many?
We had 6, but we had 2 that's left, so we have 4, but we have 2 that are fixing to age off within the next 6 months.
Okay,
So depending on which choice they choose and how much it's gonna cost.
right. And it's somewhere between 5 and 9.
876 and 960. Well, that's with the indifference card. You want, and then you have to decide if you want to offer them the indifference card as well. If you don't, then it's gonna be a lot cheaper. It'll be like 563, 600, it's somewhere there. I don't know the exact number, but we'll take the indifference card off. So
Okay,
that's what you gotta decide what you want to do, so I can let them know. Also, too, OPH and W are gonna drop all the ones that are over 65 from their Blue Cross Advantage plan. So I have to have a 3rd enrollment at the end of this month for all of them. They won't notify them either. We got an email from OPH and W, and they're not being very friendly. They said since we're choosing to leave, that it's on me to notify everybody.
we're dropping them when?
July 1st.
Oh, we're switching over July 1st, so.
But the 65 and over won't have Medicare Advantage if I don't get them in here by the end of this month.
Right.
And there's 40 some of them.
It is available. They just have to get here this
Yeah.
month, okay?
Right.
Yeah.
Or can they do it over the phone?
No, because they want them to come sit with the Medicare. We have 2 Medicare specialists that are assigned to Lincoln County now. And they will come here and go through all the options, and that's all they do is Medicare.
Okay.
So they'll help them find the best fit for them.
Yeah. And it's out of county now or out of state?
Probably. So I don't know what we're gonna do.
We need to figure that out.
Yeah. But they wanted them to come in next week, but I just don't think I can get everybody done. So I'm not being mean, but I'm trying to get everybody that's working now, because if I don't have them in by next Friday, you don't have insurance July 1.
Right.
So I'm trying to get all them in, so they've agreed to come back at the end of May and do one for the 65 and over.
Okay. Yeah, we need to figure out a digital way to do that, through FaceTime or something like that.
Okay,
Because-
now after the initial time, there always will be, everything will be digitalized after this year, but it says they have to have your original signature the first time to put you in.
Okay. Yeah, well, maybe a DocuSign or something.
Yeah, we'll try to figure something out.
Okay.
I'll get with Hub.
Yeah.
But right now, we, under 65, we would have, 1, 2, 3, and I'll show you guys, I don't wanna say their names, but I'll show you the 3.
That's all right, three's fine.
Okay,
I don't foresee a whole lot more coming down the pike. I know Dan's gonna retire, and it just depends on when he decides to. It could be 6 months, it could be nothing, you know, when he, after he retires. So, but Belinda's gonna retire, but she'll be at 65 when she's done.
and here's the thing, do we want to, if we decide to do it, do we want to put stipulations on it? Because like on the sheriff's side, they have the 20-year retirement, so they can retire. So
I
that,
would not wanna pay for more than a year. Maybe two.
so are you saying that you want to set it up, because by Oprah's rules, you can retire at 62.
Right.
So do it from 62 to 65, or what do you, or you just want to do it?
Well, here's the thought I had, since we can't pay out sick leave, can we put that sick leave money in a special account to subsidize their,
We're also gonna have the funds that come back from the difference cards.
Yeah.
So anybody that doesn't use all their difference cards, that'll start that pool that we could also use those funds for.
It's true.
right, well, but we get that money back.
Yeah.
And what I wanna do with that money is just roll it back into the benefits, just to cut the cost of our benefits down.
Okay.
But, I mean, it is a pool of money, but if we come up with rules, you have to have worked 20 years or more. And we will subsidize it for
I think there's
X
like,
amount of time or use your sick leave. But for what it's worth, and just subsidize it so they still have some out of pocket, but it's not the $900 to make it last that amount of time.
So did we find out that we can't pay out sick leave?
By statute, yeah, it says we can't pay out sick leave.
Dang.
Yeah, can't do catch money.
but out of the three that we have right now, there's only one person that's worked more than 20 years.
I personally don't see how we can do it. I mean, cause there's just gonna be so many people that didn't work 20 years, they are gonna want prorated or they wanna retire at 58. And really, if they want their insurance paid for, they should stay at work.
But your new
I mean,
your new retirees, we're looking at old system retirees really, cause your newest system,
Technically, you need 67 to retire now.
right, and it's, is it still 90 years?
Mm-hmm.
So it's still 90 years to draw your retirement and all that, so.
I mean, you can retire early, but it's gonna take a percentage of your retirement.
Right,
I mean, per Oprah's rules, you can retire when you're 62,
right,
but you're not gonna get your full Oprah's retirement.
right.
But that's when they'll start giving you the $105, because the Oprah's gives you, well, no, that's something different.
So I was just looking, we don't have to subsidize the whole thing, but I mean, if you still wanna give back their sick leave, we could put that in a pool of money and use that to subsidize them. Just the ones that don't retire, don't get it. So it would cost them, well, actually, it would probably cost less than what you were originally thinking
yeah,
on money. But you just, if you have 30 days of sick leave, then we take that and prorate it over a year or two. And, you know, it takes off $25 of that thing.
But here's the thing too, what if one's elected or was elected, then they don't have any sick leave?
And then doesn't count. And it doesn't count for the old people that have retired.
The three that we have,
Yeah, we couldn't do the sick leave thing for them.
true.
We need to figure out a special program for that.
Would it be, if we do this,
okay.
it would be the 80 and 90.
Right,
Yeah, so it would be where it would work out with the 80 and 90, not just
anybody.
not just somebody that retired, but we did 80 and 90, and then that might really remove some that
Saturday would be the last day for.
Yeah.
we're good one for 10, you know, because of 80 and 90, unless they're 80 years old. Or
Exactly, yeah, but that doesn't matter,
Yeah.
then it's their.
yeah, they are, yeah, they were 65, but it would be the, make sure they're the 80 and 90, if they were higher in the 80 bracket, then they're probably already at 65, almost close to it anyway. If they're higher than 90, then they have to finish out to the 90 before we would. Before we subsidize.
I mean, you can retire before you hit the
Exactly,
80 or
yeah.
90.
Yes,
You should lose a percentage of your retirement.
yeah, but we will continue, I'm not saying we would, if we continue,
Yeah.
we continue if they retired at the 90 or they retired at 80. Yeah, not if they retired
Yeah,
Yeah.
you know,
at, yeah,
20 years and they're over 50 years old, then.
Yeah.
yeah, they don't have the 80 or 90.
They don't have the 80 or 90.
But you have the 20 on the hazardous pay on the sheriff's side and the detention side.
That's,
But that,
So,
you couldn't do that.
you couldn't do that because it's a hard 20 years
Mhm.
and they could be 50 years old.
Yeah.
And so that's 15 years of subsidizing, we can't afford.
Yeah,
Mhm. But they get full retirement before anybody else
They
does,
do.
so that's a benefit they
Yeah.
have that no one else has
Right.
in that area.
because they pay more than twice than what in the normal person pays.
Mhm.
I mean, I would say if you're gonna do it for like 62 to 63. If they reach the 80, 90. I mean, that's my opinion, because you can retire at 62. Just cut some of yours. Retirement down.
Yeah.
I mean, we don't have that many, like I said, we have 3 that's under
You're retired at
65.
62, if you don't hit your 80 or 90, then they cut it down.
Yeah.
If you hit your 80 or 90 at any time,
You can retire from 62 on.
well, you can retire prior to that, doesn't.
You can, but if you're not 62, they're gonna take like 2%.
I thought
your retirement.
I thought they hit, if you hit that 80, you're fully.
You can, but they do take a little percentage. I mean, it's like 0.01% or something like that for you not being 62. That's very, it's like $1
Right.
is what you lose.
So, I don't know, it's not a bad plan though. And when you hit your 80 when you retire, or 90, depending on the system you're in,
Mhm.
and you're 62, then we can subsidize a little bit.
But also we need to make it clear that doesn't include spouses, because some of them include their spouse too. So we'd want to make that clear that it's only the employee.
It's only them, they have to pay for everything.
Yeah.
Yeah.
Really, about
Yeah. Is there gonna be a way to legally? I haven't got to talk to Stacy, so I hadn't heard that we couldn't do the sick time thing. But is there a way to legally say? I mean, so if a person has no sick time saved, are we not gonna do theirs? Or are we just gonna go, that just strictly, everybody's created the same if they meet their 90 and.
I think they're 80 or they're 90, and then we just, for a year, we could choose a year, we could choose 2 years, we could use a sliding scale or 50%, we could choose any percentage there, so they're not paying $900, they're only paying $450.
That is if you want them to have the indifference card.
Well,
Yeah.
yeah, I mean,
Yeah.
that's still gonna be the roundabout amount is somewhere around $900, no matter which direction we go, from $700 to $900.
Yeah. So, but the 3 that we already have. 2, I'm looking now, 2 of them were elected and 1 was not.
Right.
So they wouldn't have 6, so would we pay theirs? 2 of them are aging off this year. There would only be 1
Right.
pre-existing ones, which I'm gonna call pre-existing,
Correct.
that would we have to pay for.
Yeah, I don't mind. As long as there's no legality issues, I don't mind doing it for elected officials either, because you work that well for the county in any fashion. Wouldn't be a bad deal.
So does an elected official have to meet the 90 also?
I would think everybody should.
Yeah, I agree.
It depends on whatever retirement system you're on is what you have to meet.
And it only goes to your, we don't pay anybody over 65, so it would be.
Exactly.
Yeah,
Exactly.
yeah, and to hit the 90, be pretty hard. There wouldn't be very many that wasn't 65 yet.
Yeah, I mean, you'd have to start it at 18, but if you started at 18 years old, you'd be on the 80 system, so.
Well, if you started before 1999, is that anybody that started prior to 1999 is on the 80? Anything after 1999 is the 90. So it depends on when you started. So if you start now, you're automatically gonna be on the 90.
Right.
Very few people are still left on the 80.
Yeah.
Except for elected officials.
Except for elected officials,
Right,
they're different.
officials changed in 2010.
Yes,
Are you on the 80? You? No.
Mhm, the only one.
Hmm.
I'm the only one that, well, Jackie came into office before everything changed, so she's still in the 80.
she's still the 80. But she's gotta get her 10 years of elected official.
Right. Well, no, because she came in before the.
Yeah, but you still gotta be 10 years as an elected official to be vested as the elected
Yeah.
official.
Okay.
I said, and I had clarification for your question, remind me.
Okay.
Brenda, well, she worked in. Kim, was she elected with me?
She wasn't elected, and then she was elected in 17, no, she looked the same time we were, wasn't she? Brenda,
Brenda,
yeah.
she came in with me at the trip. So, yeah, because that would be Jackie and I are the only two on that, two elected officials in the league.
Yeah. But Jackie came on when 17 too, but she was hired before 2011, wasn't it?
Right.
But Brenda might have been hired before then too, 'cause she was hired,
Yeah, she worked there for.
but she worked for 8 Mile and hired her.
So she might be in the 80.
Yeah, yeah, because, yeah, that's right, she would be in the 80, so there's the three of us. But, yeah, if we do the 80, it'll still work out. But we'd say we're only gonna pay X amount of dollars. By the end.
Today, please, if I have to let Hub know.
How we're gonna set, why does she care how to pay for it?
Because we open a room with the new people next week, she wants to be able to tell, she doesn't, I mean, she just wants to know if we're gonna pay for it or not. Or how much we're gonna pay, so we have to let them know, and so when we put it in the system next week, we have to know what the percentage is that we're paying. I mean, really, I only need to know about these three at the moment, what we're gonna do with these three. Four,
The youngest one on there, how long till they age out?
I don't know. So I don't know.
Here.
I don't hit the age, but I can go look, you can go look.
And just to get an idea, because I don't remember how old he is, he's.
I don't either, but I'll go look.
See, do you have?
Yep. It's that one.
3 years.
Yeah.
3.5 years.
Yeah. Well, 2. Yeah.
Oh, wait, I'm sorry, I missed, I have 4, but he'll age off this year too. You have one it's very questionable because they age off the end of July, so we'd only have to pay 1 month
Right,
of that person. The other two that are aging off in October. So we'd have to pay through October, it'd take effect November 1st. And then the other one, that many years.
Could be 3.
and we can't pay for that long for that many people.
I think I still say, I'm still, just don't see how we can do it.
Yeah.
I mean, we're talking about not giving full raises this year and,
Yeah, that's one thing that's crossed my mind is maybe we should just let it be the same system all the way through and see what budget season does for us, and then we can
Yeah.
prepare more next year.
yeah. I mean,
Maybe we can come up with a good plan or something.
yeah,
I love our retirees, we want to help them out as much as we can.
yeah, I do too. I don't know. I mean, like I said, if you want insurance work, I mean, we pay for it if you work,
Yeah.
so.
Right.
I did have a question.
Okay.
For somebody's spouse is over 65, do we offer a Medicare Plan B or
Yes,
whatever?
we can put them on a Medicare Advantage plan.
Okay. I guess that question will come up on Monday.
And the Medicare specialist will be with us on Monday too, for them to explain that. I'm taking one of the Medicare specialists with me to each barn, so everybody can ask.
Okay, have they had that option ever?
No.
Good.
Something new.
Good.
One thing that they're adding. Then the second part of this is, do you want, even the retirees, if they pay for it themselves, do you want them to have the indifference, or I keep saying indifference, but it's difference card? Do you want them to be able to use our difference card if they pay for it or no? Cause really that's a county benefit. The county's paying for every employee's. Or do you just want them to be able to have just the high deductible plan?
So the question I have on that is they're paying for it.
They can, yes.
Yeah, the retirees are paying for it.
Mm-hmm.
They don't use that money at the end of the year. Where does that money go? Cause we're
That's a
not
good
paying for it.
question. That's a good question. Let's see if Caitlin's available.
Can we track that?
Differently,
Yeah. Can we track individuals and see this person is retired, they're paying for it themselves and give them that money back, or I mean, roll it into the system, or I don't know what the best thing to do on that is.
I just texted Caitlin, see if she could call me. And then we'll ask her those questions, but honestly, it's so new, I don't know either.
Yeah,
I'm learning with everybody else, so.
yeah, we just need to be fair, if they're paying into it.
Yeah,
and
I
they
agree.
use it, then we get that money back.
Yeah,
Then, do we wanna capitalize on that or give it back to them? I think the fair thing would be to give it back to them.
Yeah.
I don't care what plan. I think they should have the same choices that everybody else does.
is she gonna be able to call you? She hasn't answered. I accidentally called Ted Woodhead for some reason.
Well, while we're waiting on that, we can come back to this, but I agree with Ron. See how we can do that this year. I would love to. It's something I've wanted to do for a while, just not enough time. So, so let's move on. Take no action on that at this time, and we're down to opioid stimulant and substance use program.
Back in February, y'all approved us to go out for the federal grant for $1 million. And, we submitted it yesterday, right?
Yes.
And part of that, it's a 3-year grant. And, part of it is going to be, if we're approved for it, we'll hire, Judy as the project director or administrator. And so her salary is included in this grant. I take that back, 75.2% of it, her salary is included in this grant. The other 24.8% is in the opioid abatement grant. So, that's part of it.
And all my friends. At no cost to the county.
Yes,
What'd you say?
I'm no cost to the county, so all my benefits, the money.
everything is gonna be paid out of the grant funds.
Okay.
I'm gonna let Judy explain on the other part of it, that just a kind of a breakdown of the, um,
Okay, so that's a logic model. It's kind of what they require. Basically, it's a pictorial representation of what are pages and pages of application as a summary. And then it goes along with the fiscal ask. We're just under a million. We're 999, $326, just under a million. But this application through the DGA, they have funding priorities, just like the state does, so it can only be structured in certain ways. It is recovery focused, and it's to address, like you can look at the impact there, is what we're trying to do is get ahead of the upstream and see if we can shut the revolving door. So and it's based on national best practice models, all the evidence based, and what we're getting. And in the meetings with the sheriff and the undersheriff, and then I have letters of support, Judge Bridge is on board. We will we're contracting for a behavioral health provider. Right now in Lincoln County, it is Gateway, but it is a contract, not a subaward. So if for some reason, I don't want to get us in the position before where we only have one source. And so it is a contract, and in this 3 years, if for whatever reason they can't meet that contract or are not meeting that contract, we can look elsewhere. But it will put a behavioral health specialist, so that's a case manager or peer is what they're certified as. And Gateway will handle the employee as part of their contract with these employees and all the certifications and requirements. But the undersheriff, because they will be officed in the jail, they'll be a part of the hiring process because it's somebody that's gonna be there every day. And will be a person that can be the go-to for law enforcement. So when they get into a situation post-release where they say, okay, we've got a mental health issue, or this is somebody that is chronically or at risk for overdose, anything, there's a liaison for that individual that we can start addressing some of these issues and then working with them while they are in jail and preparing them prior to their release, that there won't be any drop off as far as whatever's the courts required for outpatient treatment, or if they have to go to 100% inpatient. So it's a continuum of services that around the nation they're finding is working. And so that's why this is a funding priority for them. It also gives, at the Gateway office, there's not room, nor is it appropriate to put the licensed counselor kind of in the jail, but that person will come also and meet with individuals who are trying to get in front of this or are interested in recovery. While they are court mandated for recovery, it's still kind of a voluntary system legally. So, it's not like you can force them to seek this. Anyway, so you can see on inputs there, basically, this is based on that joint effort of what we're doing at the state level and building on it at the federal level, because that's what they want to see. You can do the whole list of activities there. And then the outputs will be all the reporting requirements. In our contract, there is a subcontract for a analyst because we're gonna build dashboards. We're going to be able to present this data that I've been working on the past 2 years, trying to find what is our overdose rates, what does it really look like, kind of see, what does that revolving door look like? How many really are diagnosed with mental health as they're coming in? What's the percentage? All of that is what we will report on, and we will have the data capacity to capture that in a way that we really can see it visually. So that's a piece of that. I'm gonna say. Pretty intense, worth $1 million, $1 million piece of paper right here. But that's basically what we're gonna try to do, we're gonna try to, through doing these activities, structured in this way, we're going to really reduce. Those that are coming, rearrest and coming back in is what we're hoping to do. Will we do it in the first 3 years? Statistically. Well, we won't know if we ever get it done if we don't start capturing that data and start looking at this. And so this is ground floor. You know, this first couple of years, we're gonna get some of our baseline data. The nice thing about this funding, they understand that they're investing in us. This represents that we've made that investment in getting in front of our challenges, and we're investing in the people in our county. And then the BJA is coming along and saying, yeah, and they're tracking it and they're giving data like we like to see. And then the hopes is the next 3 years we can reapply if we do it correctly. That makes sense. Lots and lots of hours of work, and I sum it up so quickly.
So these will be a mandated program that people go in?
Not necessarily, so some people that are, when you're justice engaged, it's really dependent upon what the judge determines. Some don't always, some are just assigned a officer, and the parole requires them to come to outpatient treatment. Some, I mean, it's through that professional assessment which will be done in jail. So we'll know things sooner, and we can work closer with the diversion courts, drug court, mental health court, and figuring out what's the best avenue for people. Because the more people come through the system, the less chance we are to mitigate. I mean, it's like a rut, and then the rut gets so deep, and then
Right.
it's really a challenge.
Now, this grant is just paying for employees, basically, it's not,
No.
or is it paying for the actual
So it will,
actual therapy or the?
yeah, so it is, it's so on your outcomes, you'll see. Because it's service-based, it's a service contract,
Okay,
so even though it's paying for those employees, they're held to these outcomes, these named outcomes that they have to produce.
all right, so we get 10 people in jail that need inpatient. Who pays for that inpatient treatment?
They're covered in the grant.
This grant?
Yeah.
So there's a chance that we could have more people than the grant can afford.
And then I will write for more, exactly, but we don't know that until
We don't know that
Yeah.
until we start moving that.
And that is really what we need to find out, because we have hit that capacity with our state money. So that original application that I did for abatement, I mean, we've exceeded it because our need is so much bigger, but we have to document it.
Right.
And so unfortunately, we can't ask until we have real numbers for a lot of things, but this will give us real numbers, and this gives us real numbers in the way that the federal government recognizes. And so then it gives us access to other funding. So.
What and where are these facilities?
So this is gonna cover the lease for the empowerment center that, you remember how we're trying to, right now I've been trying to make it work. And
Right.
it comes through the indirect cost of the abatement funding, but if the lease is covered in this.
Right, but where's the inpatient facilities? Where are they?
So inpatient is referred out, so in jail services will be in the jail.
Right,
And the sheriff says that there's an office that they will set aside for that individual, and then they will do some groups too. You know, there again, it's all voluntary, you can't make them come, but it will be available. And then the counselor will have an office at the empowerment center, will come over and do all those in jail assessments. The goal is to get in front of this faster, because
Right.
right now we have a really bad delay and people are falling through the cracks. So,
but I guess what I'm looking for is where, if they have to, after jail, go to an inpatient facility? So
So,
we're talking Red Rock and Norman, or,
So there's about a dozen regionally
okay,
that they refer to and get them placed in.
and how's their capacity?
It's actually, I'd have to check to give you for sure what the wait time is, but it's been pretty reasonable. Everybody's been expanding. There's been money that's been available for inpatient to expand.
Okay,
I know that the Gateway is in process of trying to add that too.
where's the closest one?
Shawnee, Broken Bow, I mean, they're all over. There's Tulsa, there's Grand in Tulsa. I think there's a new one in Cushing that's trying to get up and going. Yeah, so there are more, I mean, available. But that, it's all based on the recommendation of that mental health professional's assessment. If the person's willing to go inpatient, a lot of them won't.
Can that be court ordered though?
Yeah, you're on, I'm not sure about that. I'm not sure how far they can go on that.
Sure.
I'd have to ask. So that's what it looks like.
All
And now we just wait. We'll maybe know in August. And the nice thing is this package is written. And so now I can eagerly watch others because of the data work that's been done so far, that we can jump into other applications if we feel.
Other grant applications? Okay. I want to ask a question and make sure I understand. This is $1 million grant to hopefully hire you to help people get to Gateway or a Lifeway, like similar system.
This is, yes, so this is $1 million grant to help individuals when they're arrested be assessed mentally and substance abuse and get connected to appropriate treatment. Because they don't in with the jail person, and if say they don't want to go to Gateway, then there's a couple of the places that we can connect them to. I mean, we can't force who they choose.
Right.
But this is creating more opportunity.
These are better.
And is there treatment for a while there in jail?
Yes. Yes. And it's different because Alicia was telling about some of the other contracts that coming up, and as I met with the sheriff, those contracts that you have through the state and
the Department of Mental Health and Substance Abuse, that funding is about to open back up again for the fiscal year 27. So we kind of talked about this.
that's kind of like your urgent care. You need to have that on board because this is recovery focused. That's what the BGA requires. This is all about treatment, recovery focus, and how can we help that individual begin to build a positive way out. So you're gonna always need triage support. So having that money, it doesn't impact, it's not duplication in the BGA's world. We should have both and more.
Sure. Sure. Any other questions, comments?
I don't, thank you.
Yeah.
You're welcome.
Yeah, no, it's an important thing, it's definitely a problem, so.
Quite a learning experience.
Thank you, Judy.
You ever hear back?
Kim's checking and she hasn't got back. I told her in a meeting I need a fast answer. She said, okay. After you.
Well, I think for this, let's just approve them to choose, they're paying for it, choose whichever.
Hey, Kim, I'm sorry to rush you, but you're up. Okay. I guess the biggest question is if we do give them the difference card and they pay for it themselves, and they don't use it all, where would the money go? Okay. Oh, okay. Okay, okay. All right, just let me know. Thank you so much for all your help. Bye-bye. She said that she's trying to find out for sure, but there could be a problem with the IRS if they pay for their own. Because the county is gonna, we'll be section 125, so we won't have the IRS problem. So she's thinking that the retirees pay us, but then we'll get their money. But she's getting more clarification, so I don't have an exact answer. But she said it could be an IRS problem if we offer it to them, for them, not for us.
What do they currently get? Do we have a option for something that they currently get? As far as their plan, health insurance plan?
This the same options that we have. So they would be doing the high deductible.
Do the retirees have the option to choose a plan that's just like what they're currently on? Through Hub?
We didn't elect for one.
Yeah, we did elect for one. We only elected for the high deductible ones.
Okay, yeah, we need to figure that out, make sure, I don't mind them paying us, but
But then we would keep whatever money that was left over. We'd have to figure out a way how to pay them their money back. But she did say there is an individual report that I can see who paid what.
Shannon,
Hmm,
your mind's running, what's
I
going
don't know, yeah. Can we weren't limited to just the plans that we picked, where we could have picked as many as we wanted.
Well, we could have, but when the last meeting Hub was here, we narrowed it down. And so those are the ones we're offering.
But they don't care if we wanted to pick one more, if we would have picked it then.
If we would have picked it then, we can't pick it now, cause you're killing me.
They base our rates off how many people are gonna participate in
Yeah.
that plan.
Yeah.
So if we add another plan, it takes away from the rates that the other plans will receive.
Yeah,
But if there is just 3 retirees or whatever that's on it, that's gonna be pretty easy to figure.
yeah,
If they want a retiree plan like he's asking, that's similar to what they have.
yeah. So you want me to reach back out and get one?
Yeah, I mean, I would rather not handle the money,
Me too.
No, I don't want it.
I would rather not too.
so let's find them a plan that's similar to what they have. And call that good. So just, pick one that's really close and that's what we'll go with.
And then as we phase new retirees out, will you let them choose between the existing low deductible or difference card?
I don't wanna handle the,
Yeah.
I don't wanna handle.
So they'll all switch to low deductible or high.
All retirees will switch to a
Low deductible.
low deductible plan. That way we're not handling any of that.
Yeah.
Yeah, it'd be cleaner if we didn't.
See, I just saved you work. You thought I was making you work.
Well, you're actually making me work, but you're saving me on the back end.
Well, it's a second.
There you go, there you go.
That'll fasten out and coast a little bit later.
There you go.
Yeah,
Alright.
I like it. We don't use it.
Yeah, 15 minutes to get down to OSU about, cause I think they started at 11. Ribbon cutting at 11:30, so. Do we need a motion on that?
I mean, I don't,
Yeah, I guess
You
so.
said no
yeah,
action.
yeah,
Just do no action, then let you choose
yeah,
for just retirees and we're good.
Yeah,
'Cause
I can do
we're
that.
not gonna subsidize them, okay. So 2 or 3 unpaid roads count. Oh, God, one of that stuff was so good.
Yeah.
Who's on top?
Motion I'd ask for more, man.
I know.
Motion for the lower. Give me a chance for voting. We know.
Did you make a motion or you need?
I just made it.
I'll second it.
I'm getting about 3 miles for the 100, whatever, and he's paving his with gold for 300,000.
So District 2 is heaven now, I guess.
All in favor, say aye.
Okay.
Alright. And then we'll transfer the money that we just approved.
One on top was approved the last meeting, but there was an adjustment made on the second page.
Moving money out of my deal after the good part of it. That'll work.
I make a motion to approve the transfers.
I'll accept that.
All in favor, say aye.
Aye.
Sorry. Deal.
Lee and I both got your line there, Martin.
Did you transfer under the basket?
Out in the mouth.
I didn't know.
Do you want that too?
No, did you leave any?
Are you wanting it down that size one meeting? It would be not.
Alright, we have anything else?
That's what I'm saying.
There you go.
You can't say it so fast, it's not even words or it doesn't count.
Yeah.
I missed it.
Oh, I'll make a motion to adjourn.
Okay.
Yeah, you just.
Marlon, do you second that?
Yes.
All in favor, say aye.
Stacy Bateman did read it and she gave me the okay for you to go ahead and sign it.
Well, Bill, we've done it
This
for
is what
4
Blue
years.
Cross, that was Blue Cross Blue Shield.
Made that motion every time.
I know. Yep.
And one of the grants that we,
And this one is,
one of the
you're
bids
just saying that, so
Two of the
we need to get
bids
the
that were,
invoices
um,
and the other agreement.
doing for the assessor's office remodel and the HVAC. They're available to be opened on June 4th, which is on a Thursday. Do we want to have a special meeting on June 8th to open those bids? Is there a rush to get that done, the HVAC and the assessor's remodel?
Oh, let's say, I'll just do
Okay,
it.
so just wait until the,
Unless something else comes up, I gotta, like. And I'd have a meeting every week, you give me.
okay,
There's 2 weeks in between meetings there, or 3 weeks into. So they wouldn't be able to open them and even start the HVAC replacement or the remodel project until after the 22nd, when they're awarded.
I think your logic.
And it's gonna be hot, so if they're gonna be working on everything, it's gonna be better to get it done before it gets. Yeah.
so go ahead and open the bids on June 8th, on a Monday. Or we could open them on the Thursday before, June 4th,
County clerk school,
Thursday.
county clerk school. County clerk school.
Oh, I won't be here, Amy won't be here.
Kristen won't be here.
You'll be there, oh.
Yeah.
There's an ambulance board meeting that day at 1, so we'd have to do it in the morning or 10.
Okay.
Yeah.
It may not be hot, Marlon. There was a freeze warning last night.
I know,
Yeah, they dropped all the temperatures, supposed to be 95 at the end of the week, but now they dropped them all down to the 80s, so.
yeah, I got 100
That's
acres of
still
hay
hot.
trying to dry and it's not dry.
It's not drying.
I prefer it
If
not
it's
be
like
90,
the-
we have a
yes,
baseball
I'll fix it.
tournament.
Yeah.
Yeah.
Oh, I want it to be nice, play some fun.
All right. You guys will see you down for the ribbon cutting, and I'll go through you guys.
Well, I'll see you on Monday, we either bright and early.
What's that?
I said, I'll